Welcome to Channel 17, the Town of Colonie Government Channel.
Across sub-Saharan Africa, the HIV/AIDS statistics are terrifying. There are more than 26 million people living with the virus. There are 2.3 million deaths a year from AIDS-related illnesses. Only a small percent have access to treatment. African hospice programs are trying to care for the sick, the dying, and the orphaned.
Cabin crew, prepare the cabin for landing.
On October 17, 2005, the Community Hospice of the Capital Region sent 6 hospice volunteers and 2 group leaders to South Africa.
Welcome to lovely Johannesburg. Folks, we'll be parking very shortly.
Their mission was to find ways to help victims of the AIDS pandemic. 4 were from the Capital Region.
I never was in South Africa before.
Meet Reiner Kopp, a retired chemist from Copake in Columbia County.
They get a chance to advertise for the Red Sox.
Father Francis O'Connor, a Catholic priest from Stuyvesant.
I'm looking forward to meeting all these wonderful people and also to experience the depth of the problem with the AIDS.
Father Francis Sullivan, a Catholic priest from Saratoga Springs.
It's over. We're off the plane.
And group leader Heidi Zemke, a social worker from the Schenectady Hospice. In the 1990s, a small group of hospice staff members from the Capital Region traveled to South Africa. The group was so impressed by the small African hospice as they began to work with victims of the AIDS epidemic and the overwhelming problems that the African hospice were facing that they wanted to help.
When our team of staff people came back from Africa, they met with many of us and said, you know, there's something we can do, people to people, hospice to hospice. And that was the beginning of our partnership. It grew out of our staff, they're seeing a need, and they're wanting to link hospice here with hospice in Africa to connect across the ocean, across the needs, and make this program happen.
This was the beginning of the Community Hospice Africa AIDS Partnership.
The most important thing in a partnership between ourselves and the staff we have and Community Hospice is the personal relationship level, because people coming from outside, firstly to be supportive, people coming from the States like Community Hospice workers we've had every year now, to spend time with us, to spend time with the community workers in a place like Freedom Park, gives them the feeling that there are people outside who care about them.
On this trip, Community Hospice volunteers are visiting 2 South African hospice organizations, Topologo Hospice and South Coast Hospice. Topologo Hospice was established in 1993 to serve the people of the mining area and squatter camps in the northwest region of South Africa near Rustenburg. It is operated under the auspices of the Catholic Diocese of Rustenburg.
We are specifically committed to caring for the poorest of the poor and the most vulnerable in society, particularly our women and the girl children who face enormous marginalization and discrimination in every sphere of their lives, socially, economically, culturally, every way.
This is Freedom Park, the largest squatters' camp in the region. Some 25,000 immigrants from all over Africa have settled here. It is estimated that 50% of them have the HIV virus. They are drawn to this region with the hope of finding work in the dozens of platinum mines scattered throughout the region. With no jobs to be had, most of the women have little choice but to sell their bodies to feed themselves and their children.
First thing I see is garbage. Then I see, how miserable, people are living. And I can't really imagine that this is a healthy atmosphere for anybody. And, but it seems it has established itself and, attempts to resettle them in different and better housing didn't work because others moved them in the empty shacks here. So everything looks very hopeless.
That one is HIV positive.
Oh, wow.
And this one is negative. Yes.
Bonaway Swaleni is a 37-year-old South African and a mother of 9 children. She lives at Freedom Park with 4 of her children. The youngest are these 10-month-old twins. One is infected with the HIV virus. She is also infected with the virus. She is unemployed. Her husbands are not involved with supporting her or her children.
People are trying to survive here on a daily basis, and there are so many ways of trying to survive. I mean, there has been, people who have done sex work before here as a way of surviving, and it's one of the reasons why the increase in HIV/AIDS it's so high.
Bonaway is getting assistance from Topologo Hospice, which has set up teams of home care nurses to visit her and others who are sick.
The financial demands on us are enormous. To run the hospice inpatient unit takes roughly at the moment $20,000 a month. That's to cover everything, salaries, drugs and so on. Then the home care program, the orphan program and so on. Financially, therefore, it's important to build up partnerships.
Bonaway is but one of the 900 patients that Topologo Hospice assists with its home-based care outreach program, not only in Freedom Park, but the many other squatter camps, mines, and township areas.
Our own government departments are not really in a position to do that. And the mere fact that we managed to recruit and train child care workers who oversee this whole project, I mean, it's a lot of a difference. And to make sure that the children who are supposed to get access to government grants, access to, health care, access to education, they do. And there's still a lot to be done, obviously.
It was the heroism of the staffs in Africa that impressed and moved our staff, including the magnitude of the need. And there was an intense desire to feel linked across the world with people who were united in their commitment to end-of-life care. And I think it inspired and moved our staff and made them want to, in some ways, be of help.
Topologo Hospice has been widely recognized for its innovative work and is being asked to provide training and outreach services to extended areas throughout its province and beyond. This year, the clinic's antiretroviral program was started. By giving pregnant women the best available triple therapy antiretrovirals, the diocese has been able to halt mother-to-child transmissions of the disease with a 100% success rate in its 30 cases so far. This will allow HIV-positive mothers to breastfeed their babies without passing on the disease, crucial help in an area where people are too poor to buy baby formula. Today, the diocese has 10 teams of home care nurses.
You're going to break your camera.
Sister Georgina Boswell has worked in the region since 1989 and manages the teams.
We've started up the mother-to-child transmission program. And so far we've 100% success in that every baby is negative at the moment. After being on treatment, during pregnancy, the mother and the child 6 weeks on treatment after pregnancy, when we test the babies, 100% are negative so far.
Evelyn is caring for her sister's 6 children and her 5 children. So she has all of them that she cares for. And she lives right here in Freedom Park. Yes. Hello. Hello.
It is estimated that in sub-Saharan Africa, 12.3 million children have been orphaned due to AIDS-related illnesses. They are left to fend for themselves and are the most vulnerable to abuse and neglect. The Orphaned and Vulnerable Children's Program, or OVC, implemented by Topolojo at Freedom Park, addresses the needs of AIDS orphans and HIV-infected and affected children by providing home-based care and support, daycare facilities, and access to basic and essential services.
Bye.
People often ask, if we are involved with this Africa partnership, are we not taking away resources from our local programs? My experience has been just the opposite. I think our involvement in the Africa partnership has allowed us to establish new relationships with organizations, businesses, and communities of people in our region who might never have learned of our hospice program had it not been for our African partnership. It has increased our visibility. It has allowed us to make contacts with other communities who have not known about us before, and I believe it has brought some additional interest and dollars to our hospice program. So I think all in all, our affiliation with the Africa Partnership has only enhanced our hospice program in this region.
Sun in the background is the giver of life, the tree of life, and the petals, the leaves on the tree represent all our programs out in the villages. And the 2 adults and the child is the outreach program, the ART program, and the orphan and vulnerable children.
Another core program is the new Topolojo Hospice inpatient facility, built in an eco-village concept to provide inpatient care for dire cases at the very end of life. The facility replaces squalid shack settings with a dignified hospice environment. AIDS orphan foster care programming and a daycare center are also in the planning stages.
The hospice was meant to be 20 bedded. We are meant to have 5 beds in each unit. But because of the demand or the large number of patients, we find ourselves having, like today, we've got 26 patients. So we are using the training hall, which as an overflow ward. It's not conducive as a ward, but it is a ward.
Tryphosa has been here for 3 weeks, but she thinks she's going to be here a long time. She wants to go home, but she doesn't know when she's going to go home.
Much of this work is accomplished with the funds raised by the Community Hospice Africa AIDS Partnership and other partner groups from around the globe.
In just a few years, they have built these buildings. They're treating how many hundreds and hundreds of patients. They're growing and changing. They could have easily just turned their back and not done anything, but they're not. They're changing, and our help and our partnership is assisting. We're just a small part of what they need, but we are assisting them, and I mean, just the smiles on people's faces, that alone, when people say, oh, you came to visit me, you came to see me, that alone makes people, helps. And it's money, it's friendship, it's handshakes, it's hugs, it's all of that. And that, yes, absolutely, we're doing something.
These people feel they are respected, that they have a dignity, that they are precious to us. That's at the heart of Topolojo, and if we ever lose that, I think we've lost it totally. Therefore, to have a community hospice coming in and for them to experience people from the States who are working in the similar field but with the same value system is terribly important to reinforce what we're all about.
Since 2003, the Community Hospice has given more than $200,000 to the African hospices. and there is so much more work to do.
It breaks my heart because I know that I'm so fortunate and other people just aren't. What little bit we can do makes everything worth it.
The Community Hospice volunteers also travel to South Coast Hospice, located on the east coast of South Africa in Port Shepstone, an hour's drive south of Durban. Since its beginnings in 1983, South Coast Hospice has evolved from modest beginnings in a volunteer's home to a dynamic organization, respected internationally, nationally, and locally. The program has grown to serve over 1,000 patients and their families with a reach throughout the rural district of KwaZulu-Natal, an area of about 2,000 square miles. Most people reside in the impoverished outlying rural areas where housing is traditional and homesteads are scattered. Services and infrastructure are basic. Existing roads become impassable in wet weather, and it is sometimes necessary to walk 3 or more miles just to fetch water. The Integrated Community-Based Home Care, or ICHC, is widely recognized as a best practice. The model uses highly trained men and women from the local community as caregivers for persons with HIV/AIDS. They are supervised by a professional hospice nursing sister and go out into the countryside in teams.
And the Izingolweni Clinic, they do the testing, HIV testing for the clients. And then they do tell the patients about hospice. If someone agrees to be visited by hospice, they sign a consent form and then they refer the patient to us. If we don't meet the patient here at the clinic, they take the direction and then we can meet the patient by his or her home and then we can carry on with our procedure. If someone got sick whilst we are here, we do transport him away to the hospital too, because the ambulance takes a long time to come to here to the clinic. Yes.
They respect us because we are working in collaboration with the clinic. They will refer to us the clients that they have cancelled during the course of the week that would like to join the hospice care program, and then they will give us the direction to their houses.
We are going to visit Esther Kolo. She is our client since 1997. She has got 10 kids. That's where she is living now. She has lost her daughter last month, who was also our client. Coco. This is the treatment she took from the clinic. She took from the clinic yesterday because she was having diarrhea and coughing too. So she went to the clinic and collect her medication. And she has got the Kozol. And she is also coughing since she has lost her daughter. Her condition is improving bit by bit, slowly. And if she goes to the clinic, she has to walk because there is no transport to the clinic. Yeah.
I was struck by how many of the staff going out every day would be witnessing the devastation in their communities and then go home themselves to take care of their uncles or their fathers or their sisters who themselves were struggling with the disease. A number of the nurses who I went out with not only were taking care of their own children, but were adopting other children who had been orphaned by the AIDS epidemics and trying every way they could to mobilize resources on behalf of the kids.
Days are not the same. Most of the patients are of my children's age. So if I know that I'm going to visit so and so who is like this, I can feel the pain inside. But at the end of the day, I appreciate myself because I can see that I've done something for that patient. Even if I don't have anything within my hands, just seeing us as caregivers, they just became so happy. We are the relief to them. So at least if you see someone still smiling, even if she or he is in pain, that makes you happy, and you can see that, okay, I've done my work and I've set my goal. That makes me happy.
With an epidemic of this magnitude, we are morally obliged to use every opportunity that comes our way.
Kath DeFilippi founded South Coast Hospice in 1983. While initially focused on cancer cases, South Coast Hospice now dedicates the majority of its efforts to coping with the overwhelming impact of HIV/AIDS in one of the most highly infected populations in the world.
The amount of human suffering that's been caused by HIV/AIDS, I think, is unprecedented. And the very worst of that is the impact on the children, in that so many children not only are they being orphaned, but they've been traumatized. They've had to often be involved, sometimes alone, in providing care for dying parents. The whole sort of wheel of life has been turned upside down. The very part of society who should be nurtured and cared for are the ones who are having to carry this enormous, unprecedented burden of care.
In the rural area of KwaZulu-Natal that South Coast Hospice serves, the unemployment rate is 72%, poverty is common, and the need is great.
This partnership has been an incredibly wonderful, I think mutually beneficial experience, which is deeply cherished here by South Coast Hospice. And it's been amazing to discover how much we've got in common, despite the tremendous differences that also exist. I think the generosity of our American partners is initially what just really slayed us. And we still wonder whether things had been the other way around, whether we would have responded with such generosity.
We are visiting Naledi. She is 8 years of age. She came to the program last year, 2004. Knock, knock.
Sanbanani. Ninjani.
Oh, Dompaisana. No, Hopo.
Naledi was adopted by this family. Her mother died of HIV and AIDS, and she was rejected in her family. She is crippled on account of the HIV and AIDS.
8-year-old Milady is but one of thousands of AIDS-infected orphan children. She is a victim of mother-to-child transfer of the HIV virus, the stigma of AIDS, and abandoned by her family after her mother died. Milady is being cared for by her mother's friend and by these wonderful hospice caregivers.
On one of my trips to Africa, I was with the nursing staff who worked with bereaved children, and they pulled out a little box like this. These boxes are now being made by a small cottage industry in South Africa. These are called memory boxes. The hospice staff sit down with the family and sit down with the children, so that if a parent is dying, this box becomes the place where the parent and child together can store some memories.
This is my family, whole family.
And in this box goes the birth certificate of a child, sometimes a lock of hair, a piece of clothing, a small coin, or a comb. Anything that a parent wants to leave behind for a child.
A house.
Okay.
Where I'm coming from before when I born.
Okay.
Little house.
Some of the parents, it's not easy for them to disclose. They can disclose by writing the letter or left any information from the in the memory box in order for the children to read when the mother has passed away.
Hospice is about improving the quality of life, helping people to live as fully as possible for as long as possible, but it's also about, when the time comes, contributing towards helping people be able to die in peace and with dignity. I think it's hard to imagine how that can be possible if you're a young mother with young dependent children and no plans in place for them to be taken care of.
With so many children being orphaned now in Africa, this little box often becomes their only tie to their parents. And as the children are orphaned and go and are placed in other homes, they take this little box with them. It moved me so much to know that in one little box contains the whole life history of a child and their tangible connection to a parent.
We've now been doing this for enough years to know how precious those memory boxes are to the children after the parents have died. And so it's a small but I think important way of helping, and I think many organizations in South Africa are doing different things, and I just hope and pray that collectively, together with the incredible resilience the children have, it's enough to lessen the impact so that we don't have a generation of lost, maladapted individuals who are angry, which could be disastrous.
South Coast Hospice, through the Memory Box Project, hopes to assist children to restore their sense of belonging and identity and to grow up knowing they are loved and cherished. The Community Hospice Africa Partnership Fund is committed to providing hospice-to-hospice financial support to carry on important humanitarian work with Topologo and South Coast Hospice.
We're all very proud of the fact that Community Hospice and the two South African partners, that this partnership model is now being viewed again by the international community as, you know, the winning recipe for success.
I find myself thinking and wondering very deeply about what is the future of some of these nations when their children have no parents, and that you have children coming to age who've been orphaned all those years. What happens to a nation over time when you lose an adult generation and your kids don't have the benefit of that adult generation?
Welcome to Channel 17, the Town of Colonie Government Channel.